Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. In this segment, we're going to be speaking with Navya Davuluri. She's joining us here as co-founder and chief executive officer of Curie AI. It's a virtual respiratory care provider. She's going to talk about how they're leveraging AI to capture sleep noises and patterns to proactively get ahead of COPD and other respiratory issues. She's also going to talk a little bit about why management of COPD has been a bit difficult for patients, why in urban environments, people tend to have more respiratory issues than in suburban environments, and a bit about how living in a rural area affects treatment options and access to care. Welcome to Health Professional Radio, Navya Davuluri. Thank you for joining us.
Thanks for having me, Neil.
Well, co-founder, chief executive officer at Curie AI, give us a bit of your professional background and talk about Curie AI's mission.
Absolutely. I'm trained as a biomedical engineer. I went to USC for my PhD. And finished that in 2014. And ever since then, my work has been focused on building products and technology for monitoring a variety of chronic conditions. For the past 4 years now, I've been working on developing new technology for respiratory conditions, specifically monitoring how people experience respiratory symptoms while they're sleeping at night. And this is the work that we are actually focused on at Curie.
Leveraging AI to capture sleep noises and patterns. I mentioned that in the outset of our conversation. Why is this leveraging of AI to capture these noises and patterns to get ahead of COPD and other respiratory issues, as I said? Why do you feel that's the best path to preventing adverse health events?
Yeah, so patients with asthma and COPD are told to manage their condition by really trying to follow their symptoms and the severity of the symptoms, like wheezing, shortness of breath, etc. Now, the only tools that are available to them is subjectively keeping track of how difficult it is becoming for them to breathe, and especially these symptoms exacerbate and become worse overnight. So, there's really no good objective way of keeping track of how these symptoms are developing overnight. And this is where AI is a great tool, especially audio AI, that helps us understand the audible symptoms that people are experiencing at night, and to objectively really try to gain an understanding of the severity, the type of symptoms, etc., without having patients to do it subjectively. So this is why we really believe that audio AI that captures the symptoms without asking the patient to go through any behavior change in order to be able to keep track of these symptoms is really powerful.
So there's nothing to wear, like some type of machine or mask or a device sensor on the body while you sleep. It's all done through audio with a speaker?
That's correct, yes. We provide patients with a cellular connected tablet that sits at the bedside, and through the audio that the tablet is picking up, we are able to identify a variety of symptoms that the patients are experiencing while sleeping.
Why has management of respiratory issues during sleep, why is that such a problem when it comes to COPD and other respiratory issues? I mean, people that suffer from diabetes, they have a wide variety of respiratory management options.
Yes. So diabetes, there has been a lot of innovation that went into diabetes management, Neil, just in the last 10, 15 years. Diabetes management begins with helping the patients understand their blood glucose levels through a glucometer. And that objectivity around knowing what your glucose levels are and then being able to modify your diet, exercise, and medication accordingly is a really powerful tool in diabetes management. However, there is no such objective measures of respiratory health today which is why, we truly believe that developing a, objective measure of respiratory health is going to really empower patients in being able to manage their condition better.
COVID-19 obviously is a respiratory virus. How has the impact of this pandemic exacerbated respiratory issues from what you've seen?
Oh my God, yeah. COVID has really been the worst nightmare for people with respiratory issues. I've just been visiting a few practices, all over the country, talking to a bunch of pulmonologists, and the impact has been the patients not being able to come in to see their doctor for their timely visits, and not receiving the, proper care that is really needed, for them to manage their condition, which led to, lot severe, conditions, lot more hospitalizations, lot more ER visits that are happening. Also, people that with respiratory issues were the hardest hit from COVID. Their lungs are already damaged, and on top of that, COVID made it impossible to recover to anything prior to pre-COVID in this patient population. So it had a tremendous impact.
Growing up, we heard a lot about pollution and smog in the urban areas affecting people's respiratory health. In many cities, we have indexes during the weather that says, stay in, it's safe to go out today, or it's not very safe to go out today. Why do people in urban environments tend to have more respiratory issues?
Well, as you rightly pointed out, urban environments, there's a lot more air pollution that makes it harder for the lungs to clear out the particulates that are entering into the body. There's also a lot more at-home pollution is a term that is gaining a lot more attention now. The particulates in the home environment are increasingly becoming higher in urban environments than in suburban environments. So these are, few of the issues that are contributing to increased respiratory issues within urban environment.
The air may be a bit cleaner in the suburban area, but what about access to care?
Yeah, no, you bring up a really good point, Neil. Especially in rural areas, access to care is really a big concern right now. Over the past 5 years, there is a huge difference between COPD rates in rural areas versus urban centers as well. Rural areas are likely to have more smokers. They're likely to have less access to pulmonologists. Some of the clinics that I've been visiting, people come from about 100 miles away to see their doctor. That itself is a huge barrier in being able to obtain care in a timely fashion.
Do you think that this leveraging of AI is going to be quick to catch on in the healthcare industry? We've seen a lot of progress with telehealth and remote care.
Well, we see a lot of interest, especially from large health systems and equally from smaller clinics as well, in being able to use this type of technology, AI-based technology, for understanding symptoms. The need has become tenfold and has become very immediate, especially since COVID. People have understood the fact that patients need to have technology to be able to monitor at home, especially having access to care as being a huge barrier in a lot of rural areas. We are seeing increasingly people becoming more receptive to the idea of using AI, especially for monitoring.
Give us a website where we can learn more about Curie AI.
Absolutely. Our website is www.curieai.com. You would find all the information about our product, the current solution, who we are targeting, etc.
And that is Curie, CURIEAI.com, correct?
That's correct.
Navya, I appreciate you joining us and lending us some of your time this morning on Health Professional Radio. Thank you very much.
Thanks a lot, Neil. It was a pleasure talking to you.
You
Have a good one.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Navya Davuluri, co-founder and chief executive officer of Curie AI. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.